much for being here. I'm really excited about this summer blitz today. I hope everyone has been enjoying a wonderful summer, that you're getting ready for back to school. Whenever school starts back up for you, I had a lot of teachers I talked to earlier who were Monday, a couple who are right after Labor Day. So we appreciate you being here, hopefully helping us think a little bit outside the box in terms of how we can be incorporating health into all of our subjects. And I always like to start this by saying I'm very biased. I come from a public health background. I love teaching about health, but I recognize not everyone has the same excitement for teaching health as they do other subjects. So I'm hoping that this can be a tool to give you new ideas for being able to incorporate health into the amazing work that you're already doing with the students that you work with. So what we're going to do today is we're going to talk a little bit about why we want to teach health education. What is the value of it? Give some ideas for incorporating it and go through some questions, some discussion that you all might have too. I'm super informal, so please feel free to unmute, to drop questions in the chat. If there's ideas that are sparked, I would love to hear them. And then I will send everyone a follow-up email right after we're done, and you will get access to all of today's slides and all of the resources that we have. One of the things that I always love when I go to PDs is actually going away, not only with why we should be talking about health or whatever the topic is, but also leaving with some really tangible resources and tools that you can apply in the classroom. So that's what I hope to leave you with at the end of the day today. A little bit of background about me. So my name is Jamie. I am the school health consultant with Wayne Risa. I've only been with Wayne Risa, it'll be 2 years right around Thanksgiving. But before that, I spent about a decade actually in schools. I was the health educator for Monroe County and worked for the health department. So I was in schools delivering health education. And one of the biggest things that I would hear is that, yes, this is so important. And we love that our students are learning about health. Every student needs to know how to be healthy, whatever that looks like for them. But unfortunately, most of the time we're so limited, right? You only have so many hours in the day. There's so many things that you have to be teaching with the curriculum that you have in core subjects, in special subjects, that we don't always get the chance. So how can we take health that we all agree is important and skills that we want every student to know, and then actually apply that in a way that relates to math or English or even like art? Whatever we're looking at, we can use health in those settings. I'm also really fortunate to be part of an awesome team at Wayne Risa. So, in addition to myself, we have our administrative assistant Arlo, our director Terry. We have 3 school outreach nurses and a school social work consultant. So, in the future, if you ever have questions, if I don't know the answer, I'm happy to connect you and get you to the right place. As part of my job, I also help promote Michigan's Medicaid programs for kids. So, My Child and Healthy Kids are both aimed at getting every child covered with both medical and dental insurance in Michigan. One of the things I used to hear sometimes when I was with students, when we would talk about things like dental health or dental hygiene, was they'd be like, yeah, that's nice, but like, we never go to the dentist, or like, we don't get a checkup before back to school. And there's a lot of different reasons and barriers for that. Sometimes it's just finding a provider you connect with, but we never want the reason to be that a family doesn't have access because they don't have insurance. So we like to promote both of these programs, making sure people are aware and that they recognize that the income threshold for being able to qualify is usually higher than most people think. So if there's any students or families you work with, we encourage you, please connect them with either your school social worker, with this website, with us, and we're happy to make sure that they have access to healthcare. So, talking about why health education is so important. All education is important, right? We want students to come out of school really well-rounded and to have experience in a lot of different topics, to figure out what their interests are. So, in order to do that, we need to make sure that they're exposed to everything. But health is something that impacts every student. So, whether that person is going to go on to be a firefighter or a teacher or a physician or a stay-at-home parent, every single person needs to know about their health and feel confident in their skills and abilities to manage it. I use the example a lot. I literally have a cousin who is an astrophysicist, went to Harvard, has a doctorate. He still has to wake up every morning and figure out what he's going to eat for breakfast and how that's going to affect his energy throughout the whole day. So, no matter what you're going into, we want to make sure that people have the tools and the confidence to be able to take care of their own health in age appropriate ways into adulthood when they're taking care of it independently. So, one of the things coming from a public health background that I love is actually this article from the Journal of Public Health in 1947 when they asked a really wide array of health professionals, what is health education? And this quote is always the one that stands out to me, but there's lots of different flavors. If you happen to be like a public health nerd, which usually doesn't happen, but I'd be very excited if one of you was. And it's that health education is the process of providing experiences for children and adults for the purpose of favorably influencing their knowledge, attitudes, and practices related to health. So, in other words, health education is not just telling somebody, wash your hands, right? Or brush your teeth. And it's bad if you eat these foods, right? It's really thinking about, okay, we want them to have the knowledge and the understanding, but also the confidence to practice those skills and the ability to be able to say, you know what? Yes, I can do this. I can practice these health behaviors, whatever health looks like for me as an individual. When we're looking at what's included in health education, we don't want it to just be that one semester health class that we'll talk a little bit about when we see a video in a couple slides. In Michigan, what we want is for every student to receive at least 50 hours of some kind of health education each year, K through 12. But in terms of graduation requirements, the only graduation requirement in Michigan for health is actually that half a credit health class that they get in high school. So, like a middle school health class isn't required. In elementary, it's not required as part of graduation, though we do want those 50 hours in there. So, we know that it's really limited, and we don't want it to just be that one semester health class. We want health to be something that's discussed every year, K through 12, built upon each other and scaffolded. When we talk about the benefits, I don't think that this is surprising that when we start talking about health in a really positive and non-shaming way, starting at a young age, that helps people develop healthy habits throughout their whole life. If we're teaching about eating plant-based foods and we're teaching about moving our bodies and drinking enough water and managing our stress at a young age, we don't necessarily see that as a burden. We see it as, okay, this is just something that I do, right? This is part of my routine is caring for myself. And by for myself, I'm also caring for loved ones and I'm showing that respect to my body and the bodies of others. We also know that healthy is a big issue. Most people, if you ask a middle schooler, where do you find health information? They will tell you Dr. Google, Dr. TikTok. There's not all bad things on there, right? There's a lot of excellent resources, but unfortunately, there's a lot of stuff that isn't super accurate, or even if it is accurate, that's not necessarily developmentally understandable for students. So we want to make sure that the information that they're receiving is not only accurate and they know how to be critical of finding that information, but also that it's easier for them to understand. If I go into a kindergarten class and I'm talking about brushing your teeth, and I start going into the biology of biofilms and how they build up to create plaque, that's probably more than they need to know, right? So we might use something like, oh, you have sugar bugs on your teeth, and this is how we're brushing and using it that way. Whereas maybe for our older students, like a student in a biology class in high school, dental hygiene can be a great example of that microbiology and biofilms in there and where we can weave health into our core subjects. We also want to teach health education as a way to hopefully prevent injuries and diseases. Not every injury and disease is preventable, and we definitely recognize that. But if we can really help people to be able to manage it, if we can also give people empathy for others who might be living with chronic illness or disease, that's really important too. With the ultimate goal of if people are healthier and they know how to care for themselves, less healthcare cost for them and for our society, and also a sense of self-advocacy and empowerment. In my old role, when I was at a health department, A lot of times people would call us because they didn't know where to go, and we would get cold calls. So I would get somebody who was maybe a senior citizen, and they would call and say, "Hey, I just had an appointment with my doctor. They told me that I have prediabetes and I just need to watch it." They're like, "I don't know what I'm supposed to be watching. I don't know what it means to have prediabetes. I don't know where to start." And had we helped that person develop those skills for empowerment and self advocacy and health literacy, it wouldn't feel so scary and overwhelming. It did for them in that moment. And so it's one of those things where I wish everybody could know that even in those really hard, scary moments, that you know what, I do have some background and I know where to go to get support related to my health and well being. And schools are kind of the perfect place to be able to do that. So we know that schools have contact with youth pretty much more than anybody else during their waking hours. You have a huge role on their development, on their socialization. Schools do an amazing job with our students. We develop them into young adults and their interests and their passions, and we hopefully help set them off in the world to be successful, whatever success looks like for them. And we know that there's a lot of years that they're at school and a lot of opportunities for us to be able to work with them. And one of the biggest things that we like to remind people is that healthy students are better learners. So when your student is in the classroom and they have their nutrition needs met, they have their sleep needs met, they have their mental and emotional health needs met, and those supports, the stress and coping strategies, they're able to be a much more present learner. Um, I always think of the example. I used to go to a lot of first hour health classes that would start at like 7:30 a.m. at high school. I would come in and there would be kids sleeping on the desk. Not necessarily because they were like, "Oh, I'm just going to be rude and I'm going to ignore my teacher and I'm going to ignore the class today." It's because they're exhausted. The adolescent body is on a different clock than what we teach them to do at school, which is wake up really early. They have so much to do after school, a lot on their plates. When our students are hungry, when they're tired, when they don't feel safe at home, they're not able to sit in a classroom and learn geometry or sit in a classroom and practice long division with their teachers. So, making sure that our students are healthy is going to allow them to be fully present in the classroom with us. And we have a lot of evidence that supports this. So, from the CDC, we know that things like physical inactivity, dietary behaviors, substance use are all linked to poorer grades and lower educational attainment. We do not believe that every student needs to be in all honors classes or go to a 4 year college, but we want every student to feel engaged at school. And in order to be engaged and present, we need to be physically, mentally, and emotionally healthy. So, one of the things that I like to use to kind of exemplify this is some student health data. So, the YRBS is a national survey that's put out every other year through the CDC. And what this does is it actually hand selects schools throughout the country to be representative of either just their state. So in Michigan, we're really fortunate that we have representative YRBS data for students throughout Michigan or nationally. So that's one where the CDC handpicks schools to participate in this survey. In Michigan, we only participate in the high school level, but nationally, there's also YRBS data for middle school. On a more local level, Michigan is very fortunate that we have a survey called the Michigan Profile for Healthy Youth, or MiFi. This is something any school can take, so you don't have to be hand selected. It's run through Michigan Department of Education, and this is a MiFi year that we have coming up. So if you are interested in collecting that data, please feel free to reach out to me. I'm happy to connect you with our MDE consultant. The data is private to your school. So even I can only see county level data. Because one of the pieces of feedback I hear a lot is, yeah, if we take this survey, is everyone going to know that we're the school that has like 60% of kids who vape, or we're not doing well when it comes to kids feeling supported in the classroom? All of those things are only private for you. And so we can only see things aggregated at a county level with MiFi. We have pretty low participation in Wayne County, and that data is really, really helpful. So I encourage schools, please reach out to me if you have questions, if you have concerns, however we can support you, Because what's nice about this is with MiFi, we survey students at seventh grade, ninth grade, and 11th grade every other year. So we can really look at those trends with that population and how they change over time. So if there's questions about the MiFi or the YRBS, please feel free to reach out to me. When we look at something on the YRBS, like tobacco use, so again, this is national data, and this is from our 2019 survey, so what is publicly available and has been analyzed. Looking at something like currently using an electronic cigarette or other electronic vapor product, some kind of vape, which we know is a big concern for a lot of our schools. As you can see on here, of our students who report getting mostly A's, only about 1 in 4 of them say that they're a current vape user. That number doubles for our students reporting getting D's and F's. Similar outcomes with smoking cigarettes. So typically less common that we see in schools than the vaping in today's day and age, but we do know that only about 4% of our mostly A students report currently smoking cigarettes versus almost 1 in 5. There's a lot of times it's easy for us to jump to conclusions with that. And we say, oh, okay, well, the A students, they listen in health class. So obviously they know it's bad for you. They listen, they think critically, like, maybe sucking on a battery with vapes, like long term, not good for me. But we know that there's a lot of other factors that go into it other than just their ability to like think critically about this and listen in health class. If you've ever known someone who's tried to quit smoking before, is a good example that I like to use. When people try to quit smoking, they tend to be really agitated, a short temper, it's hard for them to focus. And this could be an adult who's trying to quit cigarettes. Now let's look at it as you have a 15-year-old who's maybe been vaping since they were in seventh grade. That nicotine in vapes can be really, really strong, and we can see higher amounts of nicotine in vapes than we do in a traditional cigarette. So now they're sitting in class. Maybe they've already had like an in-school suspension, and they're trying to figure out, oh, all I can do is think about vaping right now, but I don't want to get caught. And if I like try to hide it in my sweatshirt, I don't know how good I'm going to be at this. I can't do it in the bathroom because we have all of these monitors. It's going to be really hard for them to sit in their biology class or in their chemistry class or in English and listen to their teacher and what they're doing when all they're doing is thinking about that substance, right? And the impact it has on the brain. So this is one of those things, this isn't to make us draw conclusions about why we see those gaps in A students versus lower grades, but we know that the correlations are there and they're very, very strong. Also looking at national data related to nutrition. So we know that 42% of our mostly A students, so about half, ate breakfast all 7 days of the week. So they're eating breakfast every day. That number goes down to only 1 in 5, or about 20% of our DNF students. Our nutrition fuels us for the day. Not everybody needs breakfast, right? Some people in the morning aren't super hungry, but we do know that for young people, it helps them focus. They have better educational outcomes when they do eat breakfast, which explains us seeing almost that double or more jump. When we're looking at drinking sugar sweetened beverages, so soda or pop, again, 41% of our A students report that they're not drinking a lot of soda versus 1 in 5 of our lower attaining students. This is not to say soda is bad. I don't like to call any foods good or bad, but we recognize how different foods affect our body and our energy levels and how they make us feel. When we go to our MiFi data, so this is our local Wayne County numbers from the 2023 to the 2024 school year. Hopefully we get some great new data and higher participation for this year. We see really similar things. So half of our A students report that they were physically active for at least 60 minutes every day, as opposed to less than 40% of our D and F students. When we talk about doing things like going to the doctors and going to the dentist, almost 70% of our mostly A students reported that they saw some kind of healthcare provider within the past year versus only half of our students there. And we know that checkups are really important also for looking things like asthma management, making sure that everyone's getting the vaccines that they need, that their growth and development is on track. Similar with going to the dentist. If you've ever had a dental problem, you know that when your tooth is in pain or you have issues, That's pretty much all you can think about. And the longer you wait, the more complicated the treatment is. I had a professor in college who always liked to say that it's always cars or teeth that totally derail you financially and logistically. And I found that very to be true in adulthood. But when we look at going to the dentist, again, it's about 3 out of 4 of our A students report that they saw a dentist within the last year versus only about half of our DNF students. And again, this is specific for Wayne County. Looking at Wayne County, we see really similar trends with our tobacco use. So, with vaping, using a vape product within the last 30 days, less than 1 in 10 of our A students versus a quarter of our DNF students. Percentage who report ever having drank alcohol, it's only about a quarter of our A and B students. And again, this is for high school level versus closer to half for DNF. So there's a ton more data that I could pull. I could have done a whole hour just on data, but to keep us moving forward on why we want to include health education, the easiest way to explain it is that it's one piece of the whole school, whole community, whole child puzzle. So the CDC and the ASCD came together and developed this model, which is where we want every student to be healthy, safe, challenged, supported, and engaged. And in order for us to achieve that, which is a hint, those 5 tenets in the middle are very similar to Maslow's hierarchy and what we need there. To achieve that, we have the blue circle. So these are the 10 components, and one of those is health education. And the health education can't just be that one health class the kids get in high school, or the one high school health class and the one middle school class. It needs to be something that's really integrated into all subjects across all grade levels in developmentally appropriate ways. And when we talk about health, a lot of times we think health education is just, okay, we got to teach our kids the food groups and how to read a nutrition label and make sure they're getting enough physical activity, throw in some stress and coping strategies, right? But really, it's a lot more about skills that are in there. So we want to make sure, yes, they have that functional knowledge piece, but we also need them to analyze their influences, right? When you're going on TikTok and you're seeing all kinds of different things, is that really medically accurate information? Or is this something that's one person's experience that maybe they've twisted to get more views and likes? And how do we critique that? Where do we find health information, right? If I have questions about my dental health, about my mental health, if I'm really struggling and I'm thinking, is this depression and what it looks like? Where am I getting that information? And on an interpersonal level, who can I go to talk to and to ask for help so that hopefully I can make health decisions, set my health goals, practice those behaviors, and advocate for myself and others, which are those national health education standards skills all together in this nice little chart that we have. Okay, so we are going to watch one of my favorite videos here that hopefully
An
will load.
apple a
This is
day.
actually a poem that you'll see the words come across the screen, and it's called An Apple a Day, and it kind of talks about health. We will recap it a little bit after and some of the things that stand out, but we'll take a second right now just to watch this short video here.
Is not enough. Don't let me start preaching. But shouldn't the children of the country that's the wealthiest also be the children of the country that's the healthiest? That makes sense. You'd think that would be true. I know I would. I'm just saying, wouldn't you? But that's not the case with our kids these days. Kids' health is declining in all kinds of ways. We need to improve it. We can, and we will. But it starts with thinking of health as a skill. A 21st century skill that you practice. Practice makes perfect. The unhealthy can't hack this. We've got to teach our kids by example every day. And it's tough because people stop listening when they think they know what you're going to say. Like, drink more water. Eat more vegetables, especially the dark leafy green ones. Eat less sugar. Don't drink soda, especially the sugary caffeine ones. Stop watching TV. Go play outside. Go for a run or a walk or a bike ride. Get your heart rate up every day of the week. Chew your food more. Eat slower. Meditate. Sit still. Get your heart rate lower. Set yourself a health goal. It doesn't have to be wild. It takes a lot of things to raise a healthy child. And healthy kids do better in school. They have better jobs. They lead better lives. They marry healthier husbands and healthier wives. Good health is a skill, and teachers need to teach it. Now you got me preaching, so I might as well preach it. Health is not a one-semester class you take in middle school. It should be a part of every subject. Not the exception, but the rule. Learn about good health in math, in English, and in social studies. Work on a project about nutrition in science with your buddies. And parents need to be involved too. Teachers can't do this alone. Good health starts at home. We need to own this issue because the stakes are high. What does it matter if we try to increase our scores in math and reading if scores are dying before their time because they got fatter and fatter? Healthy students make wealthy earners, not to mention better learners. The choices you make every day have the biggest impact in the biggest of ways. Check it. Why else would they say an apple a day keeps the doctor away? But new solutions to old problems. That's the American way. Who cares about keeping the water clean and pure? There isn't a problem if they can't sell you the cure. Don't keep looking for new technology to be your medical savior. Of course, it's easier to be saved by a miracle than it is to change your behavior. So we need to value health education the way we value math and reading. We can't keep feeding our children the same old lessons like junk food full of saturated fat and sugar and chemicals. We can do better than that. We can and we will. And that's the truth because the future belongs to the healthy youth. Amen.
All right, so we're back there. So I really like that video for a couple reasons. And one of them being that it does emphasize the point that I've brought up a couple of times that health is not a one semester class that we take in school. When we think about all the other subjects, whether it's literacy, it's science, it's math, it's social studies, even things like art and music, we start those subjects really, really young with our students, right? In preschool, in daycare, even, they're getting exposure to that and we're talking about it with them. Even talking about kids, health is part of their routine, right? They're eating, they're sleeping, washing their hands, moving their bodies, all of those things. But we don't necessarily put it as part of formal education to be able to work with our students and scaffold and build and develop that and really grow their self-efficacy in all of those areas the same way we do other things. We also know that when it comes to health, in the long run, that is one of the most valuable things that we have. So we can be training our students to be successful in all of these other academic areas. But if we failed to help them recognize how do I manage my own mental health? And when I'm feeling overwhelmed and I struggle with my time management, how do I know that the foods that I'm eating are going to impact my energy levels throughout the rest of the day? How do I refuse if I'm in a situation and someone is offering me a vape or they're offering me alcohol? What tools do I have in my toolbox to be able to make those healthy decisions, to practice those refusal skills? And that's something that we really want to be doing all the time and building off, which I like how that video really highlights that. So, for the second part of our lesson today is really the fun and engaging part, where we're going to go through different ideas for actually incorporating health into all of those core subjects. I did not include things like art and music in here, but I think that there's a lot of opportunities for that too. But just because of time, we're really going to focus on the core subjects of English language arts, math, science, and social studies. So diving right into that, sometimes people are like, yeah, this all sounds really nice, but like, what am I supposed to do? I'm overwhelmed. I have a lot on my plate. I'm starting the new school year already, and I kind of know my curriculum. So when we're thinking about health, I want people to take a moment to really consider where does it make sense to really weave health in there. And there are some things that are going to pop up as more clear than others, a lot of times based on your own knowledge and your experience. For example, if you love cooking, Cooking and math go hand in hand. There are two ways that align so strongly to be able to say, how do we modify this recipe? Financial health and financial literacy is part of health education. How do we budget for a meal and meal plan? It weaves really well into something like I love cooking and I also teach social studies. Food and culture are really, really connected. How can we use this as an opportunity to talk about all of the different ways that we eat in there? So, looking at what are my interests, what are my passions, and where can I see this linking with my topics? One of the other areas that can be great to really connect with is thinking about what health education are my students already receiving. And that can be formal health education, like in their health or PE classes. But maybe there's other areas where they're doing projects around this already. Can we really link that together and figure out what's going on? So, for example, if you have a health class and they're really focused on nutrition or movement or mental health right now, is there a way that we can weave that into the curriculum that you're doing? So, maybe if in health class right now they're learning about mental health and you teach English language arts, is there a book or are there short stories or passages that you can do where someone is sharing maybe their experiences with a mental health challenge, or they have a loved one who has a mental health challenge that can help give that empathy piece to it too? And then the other one that I know we all wish we had endless time to search for resources. So I've kind of helped you a little bit with that piece and tried to pull some today. Again, some of these you might be like, this is awesome, I love it. Other ones, not so much. I always like to present a lot of ideas so you can build your own toolbox because you are ultimately the experts on your students, right? I can come in with all kinds of resources, all kinds of different curriculum, but you're going to be the experts on your classroom and your community. Just like I would tell adults, I might be the content expert on a health topic, but you're always the context expert on your own life. So if I had somebody, for example, maybe who was trying to lower their blood pressure, and I was working with them when I was at the health department, I could be like, yes, let's cut back on sodium and let's get more exercise and let's do all of this. But if they're telling me, they're like, yeah, where am I supposed to go and do this and read a nutrition label and I'm on a budget? We want to make sure that all of these things are working within the context of your own situation, and no one is more of an expert on that than each individual. Another piece that I like to make sure to highlight whenever we're talking about health is that it can be a sensitive topic, and health is very subjective. So, a lot of times we don't think of it as a subjective thing because we have a lot of very objective numbers in health. So, we have things like blood pressure and body mass index or BMI, and we have all of this lab work, and we're supposed to get 60 minutes of physical activity every day for kids and all of these things. But health looks different for every single person. If you have a student in your class whose family has a great relationship with their family doctor, they go to the dentist every 6 months, they have transportation to get there, they have resources financially to be able to pay for it, they can afford to eat healthy foods. That looks a lot different than somebody who maybe their family has moved a lot. They maybe have someone who's in between jobs and they don't have consistent healthcare coverage. All of those things are going to play a role. Even for an example, when I used to go into help people with substance use disorders, we would talk about nicotine cessation. I'm a non-smoker, so for me, smoking 0 cigarettes is healthy, and that is my goal. For somebody who's in there and maybe has overcome other substance use issues with things like alcohol or things like heroin or opioids, for them, we were trying to get them from smoking maybe a pack and a half a day, if we could get down to half a pack a day, right? And that would be healthy and that would be a huge achievement for them. But that's really subjective and their health goals and what health looks like for them personally. So being mindful and considerate that health is different for everyone. We also want to keep in mind that everybody, our students and ourselves as the adults, are entering the space with our own beliefs, our own experiences, our own values. Um, I see this a lot when we talk about weight in bodies. All of us tend to have our own feelings and opinions about it, but everyone's body is their own. And there's no good or bad bodies, just like there's no good or bad food. Bodies and health come in all different shapes and sizes and colors that we want to be respectful of and be mindful that there's different cultural values, there's different cultural beliefs around a lot of different health topics. We mentioned this a little bit before, but access varies so much, right? To food, to healthcare services, to safe spaces, to be active, right? If you live in a neighborhood where there's walkable parks everywhere that are really safe, as opposed to if you're living somewhere where maybe parks are really run down, if they're there at all, they're not easy to get to. It's not something that a kid could go play by themselves really readily and safely. That's going to vary a lot too. So being mindful of the different access that we have to health. Um, and again, that language piece is huge. So I hear a lot of like good foods, bad foods, junk food. Even in the video, they mentioned something about like we get fatter and fatter. Fat is not a bad word. Bodies come in all shapes and sizes, but we tend to keep a really negative connotation to that. So being really aware of how we talk about health and making it something that's positive, that's engaging, and taking a very strengths-based approach. So looking at what are those things that we can do with our students when they're here with us and help them figure out how this fits into their own life. I like to give a quick disclaimer too. So while all health topics are good to help include in there, and we really want our students to know a lot, so not just know about nutrition or just know about mental health, but know about all of these areas because all of them will affect life, including sexual and reproductive health. In Michigan, there's some additional laws that put requirements on any curriculum or resources that are going to talk about sexual and reproductive health, including things like HIV and STIs. So before you teach any of those, please just make sure that you're reaching out to your school. Should have a education supervisor who oversees it. You can reach out to me because we will need to make sure that any curriculum that's covering sexual or reproductive health goes through some additional approval steps and ultimately a final board approval, and that any parents or guardians have the opportunity to preview that material, opt their students out before it's taught. And there's some additional trainings that the educators will get to. So if you have questions about that or see maybe where it could fit into curriculum, I'm definitely here to help you and support you and talk you through it, but I want to make sure that we're following the laws and the best practices with that too. Okay. So, a great place for any educator who's thinking, yeah, I want to do this, but I don't know where I'm supposed to come up with all of this or the curriculum or even what it's shaped like, is actually starting with a curriculum called the Michigan Model for Health. So, as part of my job, I also provide a lot of training and resources related to Michigan Model. So, Michigan Model is a comprehensive pre K through 12 curriculum, and it has a variety of health topics. So we talk about health and substances and safety, nutrition, physical activity, um, and being able to go in there and actually have a really awesome framework in place where we can look at, yeah, this is really easy to integrate into my elementary science units, or this is really makes a lot of sense with English, and I can use these things as writing prompts. So we at Wayne Risa are able to provide training, technical assistance, and assist with access to the curriculum too. So it's a really nice topic. It gives teachers all of these different areas that they can work on and focus on. And it aligns with not only the National Health Education Standards, but also CASEL, which is the Collaborative for Academic, Social, and Emotional Learning. So every lesson in there is going to align with both of those. For people who are like, yeah, the nutrition part sounds really interesting to me. Coming from a health department, one of the things we love is the USDA's My Plate education that they have available online for free. So if you are a teacher in elementary school grades, so first through sixth grade, there's a really awesome program called Serving Up My Plate. And all of this is publicly available online at no cost. And so they have curricula that you can see on there. They have videos, but what they'll actually do is when you go to each of the lessons, I always apologize for scrolling while doing this. It will actually tell you which health standards each of these units align with. So looking at on here, we are what we eat. We see some science standards related to classification. We obviously see health standards. When we look at things like you're being the chef, we see English language arts, right? Collaborating, researching topics. We have the science standards. So it will actually tell you where each of those align. And it's in there. They're really fun and they're engaging and can help solidify a lot of those health concepts in a way that students see, like, oh, okay, I see how this applies to my own life too. So I love those. They're really fun. Now let's get into our English and language arts resources on here. So some really clear ways to do it are obviously through books and your classroom libraries that you're showing. There are really awesome books starting from our youngest learners. I don't know if anyone is a big Eric Carle fan, but From Head to Toe is one of my favorite books to read with kids to get their bodies moving. Eating Alphabet Soup is another really popular one that we'll talk about in a second here. But for our older students too, there are a lot of books that actually talk about young people living with mental health conditions or chronic health conditions. And it helps build that empathy, that understanding, and also a sense of connectedness, right? If you have a character in a book, I use The Babysitter's Club a lot with Stacy, who has type 1 diabetes. Students who have type 1 diabetes or who have a classmate or a sibling with it can see that and relate to it in a really strong way. So, using books to kind of talk about it and teach that empathy too. Um, this is also a great opportunity for doing health research and finding reliable sources, doing things like writing research papers, and developing their health vocabulary at our different grade levels, so our early, our middle, and our more advanced learners. It's starting off really simple, right? Having books in your classroom about moving your body, about sleep, about our teeth. I love using food to do descriptive writing with kids, right? What are the different textures? What are all those different adjectives that we're using to describe the foods that we're seeing? And a food alphabet game can be really fun. One of my favorite things to do that incorporates all kinds of different things. We can use vocabulary, we can use numbers and math, is actually to go imaginary grocery shopping with students. Gets them up, gets them moving. We go on our imaginary grocery trip. Sometimes I'll say something, let's think of a vegetable that's red. Other times I might say of a food that's really spicy or a food that is soft or a food that is prickly, right? So we're using all those descriptive words in there, get their bodies moving. We put those in the grocery cart, we count them. Sometimes we try to remember how many we've counted at the end, get some math in there too. But putting that in there for our younger learners. For our little bit middle learners, I love a health related Mad Libs. So in the folder that you'll get after, we do have our Mad Libs in there. There's a really fun germs one, but it's a great way to do that. This is also a really good time to introduce that vocabulary related to mental health and feelings. So hopefully when they're younger, we're introducing those initial feelings words, but what are the other words that we can use beyond just saying, I'm angry, I'm happy, I'm sad, to be able to describe that. And then for high school, this is where I see a lot of great opportunities to write short stories, to write research papers, to read books about characters living with different health conditions or a family with different health conditions so that young people can see themselves and those around them in the books. So for each section, I've put together just a really brief select list of things that I hope will help you as you're brainstorming for yourself to go through this. So when we're looking at English and language arts on here, this is one of my favorite ones to start with. And this is great for our middle school and our high school students. We start using those feelings words in vocab. So instead of just saying mad on there, which a lot of young kids will use that to describe their feelings, sometimes anger if they're an Inside Out fan. But we can talk about feeling hurt, angry, enraged, critical, or skeptical, right? What are those words and what are those nuances and the feelings that we feel? So using language to be able to talk about feelings and emotions. For our younger students, again, I mentioned Eating the Alphabet, one of my favorite books, but MSU Extension, who are awesome partners, especially as it relates to nutrition education, actually have some lesson plans that they have available. And in this one, what's really nice is they've thought about all of these different areas where we can take this one book and we can talk about math and science. We can use movement. We can talk about reading in developmentally appropriate ways. So those are just some of ours. And again, you'll all have access to the slides that have this and a Google Doc where I've hyperlinked all of those in there that I'll email you after today. For our friends who are teaching math and do a lot of math education, again, nutrition, cooking, math go together really, really well. When we talk about recipes, food measurements, calories, physical activity, and counting. So it's a great way to get students up and moving their bodies. Tracking things, so things like statistics, data, graphing. I love to use sleep related to that. Especially because sometimes I never encourage people to have students put like their height or their weight, or even a lot of things like calories in terms of the calories they personally are consuming. We want to be really mindful of those personal numbers on there, but instead having them look at, oh, okay, we're going to look at these different things to track. Or what are the mental health strategies? What are our favorite coping tools, right? And making some kind of bar chart with that. Financial literacy is also a big part of health. So, how can we use this as a way to incorporate math with how we manage money on there? So when we talk about things like my plate and nutrition, sorting into different food groups, what are the different types of physical activity that we can do, counting things like how much water, especially for kids, right? How much water am I drinking throughout the day? Using things like this is my favorite food chart and starting those early concepts related to data and polling. Um, I've seen actually a really cool project that was done by a high school where they used concepts related to like data and statistics to talk about coping strategies. So they surveyed students at their school and they said, who are the people that you talk to the most, right? Is it your parents or guardians? Is it a teacher? Who are those adults? When you're feeling stressed out, do you like to read or listen to music or play with your dog? And they did a really cool survey and then made a poster actually that they had in the hallway using that data that they collected about positive mental health and coping strategies. When we go into incorporating health and math, a couple of the ones I was highlighting on there, again, recipes are an awesome one. I say this as somebody who, oh, cute emojis in there. Elaine, thanks. I say this as someone who wishes they were a better cook than they are. I love eating healthy foods. I wish I was better at cooking, but I'm always trying to work on it. I'm always trying to improve my skills. So when I'm looking at recipes, I wish that I had spent more time when I was younger having math as part of it. Conversions are a really big one. There's a lot of awesome opportunities if you work with high school students who might be interested in health sciences to help them understand those conversions of like metric system and okay, this is saying that this is in tablespoons and this in here is not, and how do I convert it? And what do grams versus milligrams look like? But recipes are a great place to start. So there's some really fun ones that we have in here related to cooking. University of Rhode Island SNAP Education has an awesome curriculum with a lot of different stuff. But they actually have a lesson for fourth grade that I really like that uses budgeting for food. So not only is it about food in terms of measurements and recipes, but they're actually looking at it in terms of cost. So they have like a budget. How much did they spend of their $20? And incorporating it that way too, to be able to think about math and financial literacy together. There are a lot of great ones on here though, so I encourage you kind of click through, play around with them, see which ones you like. If there's some that you're like, oh, I did this and it was awesome in my class, please email me and reach out to me because I love hearing positive feedback. If there's one you did and you're like, this did not go great, I appreciate that feedback too. Um, so for my science teachers on here, health is science, right? So I consider anybody who works in health to be a scientist. So sometimes people are like, oh, this feels like a very natural thing. I mentioned the HIV stuff before. There are a lot of districts that we have who actually have their middle school science teachers teach the HIV because they're not thinking of it necessarily of like sexual health as the priority. They're like, no, this is really health and science, right? This is our body, and this is how the immune system works, and how HIV comes in and attacks the white blood cells. So they actually get their staff trained in there because it's a very natural link between the two of them. So how the body works is a really big one. Again, I mentioned that phone call that I got of the person with prediabetes saying, my doctor told me I need to watch it. What am I watching? What does my blood sugar mean? What is blood pressure, right? How do these things work? Um, One of my favorites that I used to do with students is when we would talk about lungs, we would literally have them, okay, feel your rib cage. And now I want you to take a deep breath in and take a deep breath out. And I'm like, you feel those bones on there, your lungs are under it. And they'd be like, that's where they are, right? When you have those kindergartners making those connections in really age appropriate ways. Oh, thank you too, Elaine, for dropping that in the chat. We said ICN SNA website, free nutrition and various topics. Thank you. So thinking about science, I also, being public health, love to talk about germs. I don't know if in here, if anyone's ever gotten to do the glow germ, where you put the stuff on your hands and then you have the black light, and get to see how good of a job that you and your students have done washing their hands before. This is one of my favorites that I've done, honestly, with all grade levels. I've done it with adults with disabilities. I've done it with nursing students in college. And it's just a really fun thing where you spend, it's usually about $30 for the kit, but to help you see washing your hands and are we getting both sides of our hands? And here's a hint, a lot of the kids are not actually getting it. But being able to also look at the things like an environment and our health there, are a really natural alignment in there. Um, One of the other things that if you're interested in is how foods grow. So food is plants. So I've seen a lot of teachers do awesome projects, where it's like, okay, we are going to grow a bean sprout in our class this year, or whatever their thing is that they're trying to grow. And we're talking about food that way. And this is how food gets us together. Naming our different body parts, right? The heart and the eyes. When students get to those middle grades, how do those things work together, right? So you don't just have a heart that's working on its own, we have a whole cardiovascular system. And what does that include? How does it work? I love projects, being public health again, around water safety and water testing, right? What's in the water? How do we make sure our drinking water is safe? When you see those warnings, when you go to the beach saying, oh, the levels of this are too high, what does that mean? How do they find out? How do they test for it? So those are all really great ways to incorporate health and science together. And keeping in mind too, health is not just our own individual health, it's also things like public health, like water testing and our food supply. So some of the examples on science that I really like, that we'll look at really quick. So Kids Health, if you've ever used this website before, actually has awesome for K through 12 lesson plans. They're free, they're in place. They'll give you different things to do. A lot of them also have evaluation measures. So they have like age appropriate pre and post tests that you can use with your students. Again, my caveat, if it's reproductive or sexual health related, because they have some awesome like puberty lessons, just making sure that you are talking to your sex ed supervisor or you're reaching out to me so we can make sure it's all approved and whoever's teaching it has the required trainings and certification for that. I also love, I don't know if I have any science teachers on here, if you've heard of something called RadTown from the EPA, which is this really cool website that actually talks about radiation, and it's designed to be really like kid and youth friendly. But they have a history of radiation one. So it dives a little bit into social studies too, where we talk about the history of it. But they have a whole website where we can look at how radiation affects our neighborhoods, where it comes from, how do we test for radiation. So it's definitely science, but it's health in there too. Okay. And then lastly, weaving into social studies. Social studies, oh, science fair projects. I love it. Interrelated subjects, health topics, medicine, nursing, clean homes. Absolutely. Lead has come up a lot. We've seen like students do projects on lead in water, lead in paint. Thank you, Elaine. That's awesome to include in there. So back to our social studies. Sorry, I get so excited when I see these in the chat. Social studies and health also go together a lot. So when we look sometimes at how do we keep each other healthy, so those basic civics with our youngest learners, again, I keep mentioning public health, but public health, epidemiology, we love talking about the history of disease and health and all of the advancements that we have. And also looking at global health, right? What efforts have we made that have had really positive outcomes? So, some of the cool projects I've seen with our younger students is we are teaching early learners who in our community keeps us healthy and safe. And we really talk about that. How do we keep each other healthy and safe, right? We wash our hands not only to protect ourselves from getting sick, but to protect each other and stop that spread of disease. I've seen amazing stuff that teachers have done, actually, the same teachers who are growing the little plants in their classroom, thinking about where our food comes from, right? So let's say you love to eat tomatoes. And where does that tomato that you buy at the grocery store, who are all the people that make sure that tomato gets to you? And so you're able to eat it and use it for nutrition for your body. Um, I love talking about famous individuals in health. So thinking about people like Florence Nightingale, Louis Pasteur, famous pasteurization study, Semmelweis, who in history was actually the one who was like, all of these women who are having babies are getting infections because at the time, the doctors were residents. They were working in a morgue and then they were going directly to delivering babies and not washing their hands. And women were getting really, really sick. So maybe hand washing. How did that happen? So looking at the interesting history, a lot of things that we take for granted now are big projects. I love talking about food and holidays and celebrations in the context of global cultures. This is one that I actually have seen a lot of foreign language teachers do an awesome job of this. That's health, that's social studies, that's nutrition. It's all of these things put together. And then for our advanced learners, obviously expanding on everything that we've talked about, but also looking at how laws and policy have impacted. There's really cool resources out there related to the history of the Americans with Disabilities Act, the ADA, and the impact that that's had on Americans throughout time. So I actually linked a lesson in there on the next slide that has a lesson plan for high school students related to the ADA. I had one school where they actually did a research project on when Michigan banned the indoor smoking on restaurants, which I remember going to restaurants and them saying smoking or non-smoking table. But these students did not, right? That was not in their lifetime. Their whole life, the restaurants had been non-smoking. So it was a really cool project to see them present on. Looking at things like the history of pandemics, so smallpox, cholera, polio. Obviously, personal economics and financial literacy goes along with the economy and social studies there too. So just a couple, and I mentioned them on here before as well. One of them is actually Dr. Elizabeth Blackwell, who is one of the first women doctors. There's a really cool lesson plan for grades 5 through 7 that's the history of her, but it also includes a lot of English language arts concepts, and it has all of the materials that are on there for you. And then there's also a great Americans with Disabilities Act lesson plan too that I've linked. So I know that this was a lot of information in 1 hour. And in all honesty, I probably could have spent an hour on each of these sections and going through them and us getting to demo some of them together. But I wanted to try to make this something where everybody, no matter what you're teaching, got a couple of ideas to hopefully spark your thinking of how we can use health in all subjects with our students so that they get more comfortable with it, but we get more comfortable with that too. So again, you'll get all these resources for the people who are live in the PD with me right now. I'll send you an email right after we wrap up this. And for people who are watching this recording later, I hope that you can capture the QR code, which will take you to that participant Google folder that has these slides in there. And anything that was a PDF, I tried to pull and download and put that in there too. All right. Well, I hope you all have a really awesome school year. This was so fun for me developing this presentation over the summer. I appreciate you all so much and the amazing work you do to support students. And if you have any questions, you'll have my email and stuff after too. But thank you, everybody. I hope you have a great school year ahead.